So today I'm going to talk about coronary artery disease and a herbal combination, two herbs, Shen and San Qi. And we're going to talk about how those are, how they work in Chinese medicine and how it can be used for certain cardiac conditions. So first of all, just briefly, coronary artery disease is when you have blockages in the blood vessels and the arteries that supply your heart. And coronary artery disease is what leads to heart attacks. So over time, your coronary arteries, or the vessels that supply the heart, can build up plaques, and they can eventually thrombose or block the artery. And when that happens, you lose blood supply to the heart, you get a heart attack, you have chest pain, and that's a life-threatening emergency. And coronary artery disease is very prevalent. Common things that contribute to it from a Western medicine standpoint is diabetes, high blood pressure, high cholesterol, not exercising enough, poor diet. All of those kinds of things can contribute to it. Smoking, cigarettes. And so from a Western medicine standpoint, we look at coronary artery disease as a blockage of the arteries, and then the treatment is to open it up using stenting, doing a cardiac cath, using blood thinners like aspirin, using cholesterol medications like Lipitor, statins, those kinds of things. Now, from a Chinese medicine standpoint, I wanted to talk about this herbal combination, Shen and San Qi. Now, Shen is a herb that it's cooler and it has a blood moving quality. It has a blood moving property. The other thing about Shen is that it helps to nourish the blood supply and improve the blood supply of the body. And if you look at the second herb that I was going to talk about, San Qi. San Qi is an herb that also regulates the blood. It has somewhat of a paradoxical action in that it helps to slow down bleeding, but it can also help to transform blood stasis and help to also kind of move the blood in a way. And it's a warm herb, so they kind of balance each other out. And both of these herbs together have been looked at actually for cardiac conditions. There's been studies that have been done that show that these herbs together work well in terms of inhibiting platelet aggregation, which is kind of like what aspirin does, actually, similarly, in that it prevents platelet aggregation, and so it keeps the blood flowing a little bit more. And also that there's been studies showing that it can improve the endothelial cells in the heart as well, and is good for generating the endothelial cells and healing the endothelial cells. And so those are some of the studies that have been done showing that these two herbs together may have some benefit for the heart. But as always, we always want to think about things in a Chinese medicine perspective when we talk about Chinese medicine herbs. That's always the best way to think about it. We don't want to fall into the trap of trying to take herbs and use them for a Western medicine diagnosis. So we never say that at our clinic, we never say take Shen and San Qi if you have heart disease. No, we always look at what your condition is. If you have heart disease, but for example, you have a lot of phlegm or something else going on in the body, or you're very cold inside, this herbal combination may make things worse. It may not be right for you. But if you do have signs of blood stasis, and specifically blood stasis affecting the heart, and then this combination of herbs may be something that can help you. And so we always use a Chinese medicine diagnosis to prescribe Chinese medicine herbs. We never just say okay, you have coronary artery disease, here's a pill bottle for you. And that's not the way that Chinese medicine is intended to be practiced. Now, if you go online, you can find people selling herbal supplement bottles and they'll package it for different conditions, but that's not really how we think about herbs and diagnosis in Chinese medicine. We do talk about it in terms of Western pathology because that's traditionally how we talk in the West about diseases. We talk about things like coronary artery disease. And so it is helpful when you are starting out to understand how we can connect different diseases with different etiologies from a Chinese medicine standpoint. But we never do it just as a rigid one-for-one connection every single time. Coronary artery disease can have numerous different underlying pathogenesis in Chinese medicine. And one of them could be blood stasis, and in which case Dan Shen plus San Qi may be helpful. So that's just a brief background on coronary artery disease, and then two herbs, Dan Shen and San Qi, which we use in our clinic at times if the presentation matches for treating this. All right, we'll see you next time.